Hi, my name is Dr. Rob McCann, and I'm one of the team of anaesthetic consultants who look after you during your spinal surgery here at the Queen's Medical Centre. This short video will give you an overview of what to expect from the anaesthetic team when you come in for your lumbar spine surgery. If you haven't had a chance to already, I'd recommend that you read these two leaflets after you've watched this video. The leaflets will provide you with further detail on the risks of general anaesthesia and of the prone position for spinal surgery. For your spinal surgery, you will have a general anaesthetic. This means that we will give you a combination of anaesthetic medicines to make you fall into a deep sleep. In this deep sleep, you will not feel anything or be aware of anything that is going on during your operation. On the day of your operation, it's important that you take any painkillers that you would normally take. Sometimes this means that you might have to take them a little earlier in the day than you usually would. Don't fret if you forget to take them though, but please do let the nursing staff or your anaesthetist know. After you've arrived on the ward, an anaesthetist will meet you before you come to theatre. They'll discuss your health with you in detail, and then they'll talk to you about the general anaesthetic, pain relief, and anti-sickness medicines. Once you've been admitted by the nursing staff, and when it's your turn, our porting staff will take you to the anaesthetic room in the main operating theatre suite. In the anaesthetic room, the team will attach a heart monitor to your chest, a blood pressure cuff to your arm, and a pulse oximeter to your finger. This is a small device that measures the oxygen levels in your blood. At this point then, your anaesthetist will use a small needle to insert a plastic tube into a vein on the back of your hand, wrist or forearm. Anaesthetists call this a cannula, but you've probably heard it called a drip. Finally, we'll ask you to confirm your name, date of birth, and the operation you're scheduled to have. Don't worry about this, we've not forgotten what operation you're having, it's just part of our routine checks. Once we've completed all of that, your anaesthetist will give you some anaesthetic medicines through your drip to drift you off to sleep. Sometimes this can feel cold or it can sting for a short time. Once you're asleep, your anaesthetist will insert a breathing tube into your windpipe so that they can give you oxygen and anaesthetic gases during your operation. At this time then, the anaesthetist needs to also insert one or two more drips, and in some cases a member of the theatre team will insert a urinary catheter into your bladder. All of this will be confirmed to you before you come to theatre. When the anaesthetic team have completed everything for you, they'll bring you into the operating theatre. And in theatre then, the team will turn you onto your front to rest on a specially padded operating table so that your surgeons can perform your spinal surgery. We call this the prone position. We've summarised the risks and complications of the prone position for you in this leaflet, and you'll find it under the section headed Prone Position for Lumbar Surgery. Now you're ready for your surgery to start. During your operation, your anaesthetist will stay with you the whole time to make sure you are safe. Your anaesthetist will continue to monitor all of your vital signs. They'll give you strong painkillers, and they'll give you some anti-sickness medicines. Towards the end of your operation, the surgical team will inject local anaesthetic medicine into the edges of your wound, as these help to reduce pain and discomfort. When your operation is complete, the theatre team will move you into your bed so that you're now lying on your back. At the same time, your anaesthetist will switch off the anaesthetic and allow you to wake up in the operating theatre. Once you're awake, your anaesthetist will take you to the recovery ward. Most people spend about 30 to 60 minutes in recovery, and during that time, the recovery team will continue to monitor all of your vital signs. They'll give you some painkillers if you're in pain, and they'll give you some anti-sickness medicine if you're feeling a little bit sick. It's important to appreciate that it is normal to have pain immediately after your surgery. However, this will improve so that most people are able to get out of bed and walk around by the morning following their operation. When your pain is controlled, you're not feeling sick, and your vital signs are okay, the recovery team will send you up to the spinal surgery ward where you'll continue on your path to recovery. On the ward, our aim for you is to be able to drink, eat and mobilise as soon as possible. Too much pain, being too drowsy and feeling sick all prevent this from happening, and they will delay your discharge home. We're all different in the way that we experience pain and how we deal with it. We will reduce your pain with painkiller medicines so that you're able to get out of bed and to mobilise. However, it's important to know that you won't be pain-free at this stage though, and that this is entirely normal. Some of the painkillers that we give you are strong painkillers, and they can make some people feel drowsy. So it's important for us to try to avoid giving you too much, as this will slow down your recovery. Sometimes this can be a difficult balance to strike for some people. These strong painkillers can also make some people feel sick. It's important that we treat this as quickly as possible for you. So if you do feel sick, please let the nursing staff or the medical staff know straight away, as we can treat it with a variety of anti-sickness medicines so that we can get you back on the road to recovery and to home. So there you go. That's a brief overview of what to expect from your anaesthetic team. Again, if you've not had a chance, please do read these 2 leaflets, as these will provide you with more detail on what to expect. You may well still have some questions, so please remember that we are here to support you throughout your spinal surgery journey. You can give us a call or send us an email at any time using these contact details.